Alright, so when reading a head CT, I'll first go over the screen setup. On the top row, we've got our current study, and then the bottom row here is our comparison study. And you can see that each study will have a scout view, our algorithm which shows brain detail, and then an algorithm which shows bone detail. Alright, now when evaluating the head CT itself, I like to use the mnemonic "blood can be very bad" to remind myself to look at everything. I think it's a good mnemonic for people starting out. So first of all, blood. I like to look for blood, specifically extraaxial blood. It's important you have the window setting appropriately so that it doesn't blend in with the adjacent calvarium. Most PACS systems have a preset that will allow you to pre-window level this. So first of all, we'll just kind of look along the calvarium for any hyperdense blood. Look from top to bottom. Make sure you've looked at everything. You're looking for any sort of epidural, subdural, or subarachnoid hemorrhage. And you can see that there is some hemorrhage in this brain, and we'll kind of discuss that as we talk about the ventricle. Okay, the next portion in our mnemonic is the C for blood can, and that represents the cisterns. So the basilar cisterns are located in this area here. We've got the suprasellar cistern, and then I like to think of a six-pointed star with each star representing a portion of the basilar cistern. So think of a triangle here. The points here and here are the ambient cisterns, and then the anterior portion of that triangle here is the interhemispheric fissure. And then we've got an upside down triangle in this area with these points representing the sylvian fissures and this point representing the interpeduncular cisterns between the two cerebral peduncles. So it's the interpeduncular cistern here, and that's a common place where you'll see subarachnoid hemorrhage accumulate. And then back here we've got kind of a smiley face that represents the quadrigeminal plate cistern. Here's the quadrigeminal plate, so this is called the quadrigeminal plate cistern. And you want to look at these cisterns first of all to make sure that they're present. If you've got a lot of mass effect and a cerebral edema, these will be completely effaced and you won't see any of this black area, which is CSF. You also want to look for masses. This patient does have a suprasellar mass with some hemorrhage within it. And then you also want to look for subarachnoid hemorrhage, which again will show up as bright areas here, kind of layering or filling the cisterns. Alright, next on our mnemonic is blood can B. So B, we'll look at the brain. And to do that, I switched to a window that shows higher contrast. You can actually see differentiation between gray matter and the white matter here. And you can see that the window is about 45 and the level is about 35 Hounsfield units. And again, our PACS preset is number 5. But you just want to look through, make sure you can see good gray-white matter differentiation. And I can see, the basal ganglia. Here we've got the lentiform nucleus. We've got the caudate head. And you've got your thalami here. And then you can see the gray matter aligning the cortex bilaterally. An important area to look at is this insular ribbon. When that's typically one of the first areas where you'll lose gray-white matter differentiation when you have a MCA infarct. But here we can see that there's pretty good gray matter lining both insular ribbons. And you also want to look for any intraparenchymal hemorrhage, which would be bright areas in here. And this person's shows some kind of chronic white matter changes in the periventricular white matter, which is pretty common in patients as they age. But we don't see any obvious masses or edema or hemorrhage that's intraparenchymal. You'll want to check for midline shift. So you can kind of draw a line here, make sure that the midline structures aren't shifted. You want to look for pneumocephalus, which would be important to switch to like a lung window. You can see air. If it's a contrast enhanced study, then you'd want to look for any abnormal enhancement or lack of enhancement. Other things you can look for would be like a hyperdense MCA sign. You can see that the MCA would be located in this area. Sometimes if you have thrombus within that, it might appear hyperdense. You also want to look for calcification, and this is pretty dense. You might switch to a different window to see, is that calcium? No, calcium, which you commonly see in the choroid plexus, but the blood here isn't as dense, and that is better seen on different windows. Okay, the next step in the mnemonic is the V. Blood can be very. That stands for ventricles. And what we're going to do is we're going to look at first of all, start with the lateral ventricles, right and left lateral ventricles. And here we do see that we have some intraventricular hemorrhage. We can see normal calcification in the choroid plexus bilaterally. And then kind of a classic look to this intraventricular hemorrhage is you have blood layering posteriorly in the occipital horns of the lateral ventricles. And that's a really common location. If you only have a little bit of intraventricular hemorrhage, oftentimes it'll be layering posteriorly here. And that can be hard to recognize if the ventricles are decompressed. You might not even see much occipital horn. You'll just see a little bit of bright blood there posteriorly. Next is the third ventricle here. We again see blood there. Here's the foramen of Monro, which is an important area to look for. Or if you see a colloid cyst, classically that's the location where it'll be seen. And also like a subependymal giant cell astrocytoma in patients with tuberous sclerosis, that's the location you'll see that lesion in. Then you follow the aqueduct of Sylvius down inferiorly to the fourth ventricle, and there's probably a little bit of hemorrhage here in the fourth ventricle. You also have choroid plexus here as well, but you follow that ventricle, and then out laterally you've got the foramen of Luschka out here laterally with CSF seen there. Foramen magnum, which you can see CSF in. And then it's important to look for any low-lying cerebellar tonsils, and I usually recognize that if you're at the level of the dens and you still see cerebellar tonsils, which we don't see here, then that would be abnormal, indicating that they're low-lying either due to a Chiari malformation or herniation from mass effect. So that's important to look for. Alright, so the last B in our mnemonic, blood can be very bad, is for bone. And here I've switched to the bone algorithm, which again has a higher resolution but is a noisier image, which you can kind of see here. You don't see those really low contrast brain lesions as well as you would with the other algorithm, but it's excellent for bone. So I'm just going to go along the calvarium looking for fractures. And you can see that there are sutures, which you want to be careful not to confuse for fractures. You have sutures here, but there's no fractures in this calvarium. And you also want to look at the sinuses. Well, you've got the maxillary sinuses. We don't see any air fluid levels indicating hemorrhage. We don't see any abnormalities in the sphenoid sinus. Here are the ethmoid air cells, and then the frontal sinuses look okay. The mastoid air cells back here can have fluid in them, which they look okay here. And then you might also look at the middle ear, look for fluid there. If the patient's had facial trauma, you want to check the zygomatic arch as well. But there's no fractures in this skull.